Hi, I'm Dr. Bishwarup Roy Chaudhary and I'm going to talk about 5 medicine which you can not buy at any cost. However, you have already inherited it from the God. Number 1 medicine, time as medicine. Eat within the bracket of 10 hours between 8 am to 6 pm. Don't eat before 8 am or after 6 pm. Finish your dinner by 6 pm. There is no restriction for water, but rest of the food between 8 am to 6 pm. If you can do it, for most of you, about 70% of you, you can expect to see a drop in your blood sugar within the first 1 week, a drop in your blood pressure within the first 7 days to 10 days, drop in the pain, the bone disease I'm talking about within the first 15 days, and within 1 month you will see the excess weight is gone. For remaining 30% of the patients, I'll talk about the second medicine, what I call as food as medicine. Here, important is the DIP diet, the kind of diet which I created about a decade back. This is a diet, probably the only diet which has the credit of getting the clinical trial done by 3 countries. In India, the clinical trial was done by Ayush Ministry. In Nepal, the clinical trial on DIP diet was done by National Health Ministry and Government of Nepal. In Malaysia, the clinical trial was done by Lincoln University. And these clinical trials was done on chronic kidney disease, on diabetes patients, on high blood pressure patients, on obese patients, on bone disease, and it has got a tremendous result. This means if you belong to any of these disease group, then the DIP diet, in addition to time as medicine, can be a wonderful solution to reverse your illness, and that can expectedly help you to get rid of all this illness, or it can help you to get rid of all these symptoms and of course the dependency on the drugs. If you want to know more about the DIP diet, you can just Google, and I'm sure that you'll find some videos somewhere, because now this diet is already very popular all across the globe. Third medicine, that is gravity as medicine. This is for those people who are dependent on dialysis, end stage chronic kidney disease. Gravity as medicine. Right now I'm standing, this means 2 forces are working on me. One is the force of heart, which is pulling the blood up, and another is force of gravity, which is pulling the blood down. This balance is helping me to live a life. When this balance is lost, that is mostly called as chronic kidney disease. So to bring back the balance, you have to use gravity as medicine in addition to the 4th kind of medicine, that is heat as medicine. If you combine these two, that can be a solution for chronic kidney disease, especially those who are dependent on dialysis. Heat as medicine, to accommodate heat as medicine, we normally use Ayurveda, Panchkarma. So if you want to know more about it, I suggest you to read my book, End of Transplant, and everything is given in detail. Now I'm going to talk about the 5th medicine, 0 volt medicine. Very simple. When your body is at 0 voltage, that is a time when your immunity works the best. And if your body is on 0 voltage about 10 hours a day, that means for 10 hours you are giving the body an opportunity to work at its peak as far as immunity is concerned. So these 5 medicines, if you learn about it, you will be able to use it at home and you can become your own doctor. I invite you to participate in my 72-hour camp, the next camp at Kuala Lumpur, 24th, 25th and 26th November. And to participate in this camp, you can contact this number. The number is already on the screen. Those who are curious to know more about it, I suggest them to read my book, The Fish Tank Model for Heart Care. Here in 2nd section, you will find an observation study done on my 72-hour camp, and the result of it will excite you, and then you will know this camp is not only beneficial for the patients, their family member, it is also beneficial, it's going to be beneficial for the doctors as well, because now the doctors can have these 5 additional tools to help the patient. So hope to see you in the camp, and further in this video you will see some testimonials, some success stories of our previous camp participants. All the best. Thank you.
Kreatinin saya sudah menurun daripada 370 kepada 340. Sekarang saya masih nak meneruskan lagi saya punya diet ini.
I'm very happy, and not only me, but I also observed that the seminar participant have improved their medical.
Sorry.
Have improved their medical condition as much as I am too. I'm glad that my BP now getting better, and Dr. Bisharu have reduced one of my medicine, and I'm looking forward for complete disengagement from the medicine introduced or prescribed by the medical doctor.
I myself lost 2 kg. I see people who take insulin no longer need insulin. I see people who take meds, didn't take meds, but was alright during the session, the entire session. So basically, the session was good to learn how to reverse back whatever sickness that you had. So I seriously encourage if those who wants to attend, this is the good time to attend because you are reversing your sickness to get good health.